Right. Hi, folks. Good morning. I think we will go ahead and get started. Happy Tuesday. I want to start this morning just by wishing everyone a happy Black History Month and want to honor Reverend Jesse Jackson, who passed away this morning at the age of 84. As the governor and the first partner noted in a statement today, Reverend Jackson's legacy is one of fellowship, reminding us all that we must turn to each other and not on each other. He challenges all really to live up to the promise of equity and equality and justice for all. And I think that's actually a very important message in general, of course, but also as we enter today's session. Additionally, I want to wish everyone a happy Lunar New Year. We are entering the year of the fire horse, which my understanding is that it portends intensity and a fast pace. And I know some are thinking we may already be in that, but in any case, buckle up. Here we go. So, with that backdrop, right, taking a deep look at equity, bringing with it energy and passion, very excited to welcome you to today's webinar, which is the first in a four-part series called Transforming Together. The reason behind all of this effort, this body of work here, is because as the efforts related to the Children and Youth Behavioral Health Initiative progress, as implementation of a community schools model progresses, as reforms to the juvenile justice system progress, as reforms to the child welfare system progress, the question is, of course, how do all of these pieces fit together? How might county agencies, tribal governments, community organizations work together and center children, youth, and families and better serve them, right? So we can jump to the next slide here. That's the goal of this webinar series. So really excited to talk about that through this series, but also in several written documents and guides that we'll share more about throughout the piece of it. Today is the first part of the series. It is the introduction with a focus on shared leadership. But please note, mark your calendars for the other sessions coming up, one each month, essentially. So in March, we'll be talking about realizing shared goals. In April, realizing a universal array of services and how to think about the workforce from a broader perspective rather than each individual agency or organization. And then in May, we'll be talking about shared financing and sustainability, and again, how we link arms and integrate and align our various efforts. We can jump to the next slide. I forgot to introduce myself. My name is Sohail Sood. I serve as Director of California's Children and Youth Behavioral Health Initiative. But really today, you are in great hands with many of the other folks on here. So featured on today's call is Elizabeth Estes of Breaking Barriers, who really has spent the greater part of her career dismantling silos. Rick McManus is also on the call from Mathematica, an expert really in research and data methods to interrogate these very questions of alignment and integration. And most importantly are Trina Frazier and Amanda Rosen of Fresno County different agencies, one from the County Office of Education, the other one from County Behavioral Health. These are folks actively working on these pieces and very excited to hear from them to share those lessons. And so with that, to really guide us through the conversation, I'm delighted to turn it over to James Soward of San Bernardino County Superintendent of Schools, who really does a little bit of everything. He's practicing these lessons every day in his role at the county office. And if it's okay, James, I'm going to share that you're also studying this topic as you work toward your doctorate degree. So super excited for all of your efforts here, and I will pass to you. Thanks all.
Thank you, Sohail, and good morning, everyone. And happy to be here and to welcome everyone. Just certainly want to honor the space and ensure that everyone who's come here and come to this space has an understanding of what our objectives are for today. As Sohail said, my name is James Sauer, and I am a program manager here at San Bernardino County Superintendent of Schools, and I get the privilege to program manage the T Square or Transforming Together work that we are doing. And so one of my jobs today is going to be to introduce Transforming Together, but also as we go through today's objectives, we're going to help to define what an ecosystem of care is. We're going to review the introduction and chapter 1 of a guide that we are beginning to, we've already started to write and to begin to implement. We're going to explore the necessity of shared leadership and how to approach building it. And then we're going to learn from Fresno County, who's already experiencing much of this work and the work that's happening with Mathematica, who's one of our partners in this work. And lastly, we'll do some reflections and some question and answers for folks as you all finish the day. So, and we go to the next slide. The intended audience, again, who is this for? Really trying to engage our county agency leaders, our tribal partners, as Sohail was speaking earlier, tribal partners, our education partners, behavioral health, child welfare, probation, juvenile justice, public health, and regional centers. Many times, this space has been very heavily education, and I think as Sohail has been leading this work, really trying to engage our other partners who are touching our communities and engaging with our communities on much of the other work that's happening outside of education. Then, of course, our community partners and our community-based organizations, and of course, our parents and our youth, the main characters of this work. And we'll go to the next slide. So, what is transforming together? Let's go to the next slide. So, Transforming Together is a multi-year initiative through CYBHI. Here in San Bernardino County Superintendent of Schools, we kind of call it the 21st work stream of CYBHI. But this work is to really help align education, health, and human services, translate vision into implementation, and then support county-led system change. Again, this is funded by CYBHI. Easier way to say all those four bullets is really the work that CYBHI has intended to do, the work that community schools is intended to do. These large investments in our state, over $9 billion. This initiative here is really to bring those two big initiatives together and make them active and make them implemented. Help counties implement it to support local education and local communities. Right. So T2 is currently focused on 4 demonstration counties. So we've partnered with 4 counties in our state of our 58, but we have 4 who are piloting this work, and that's Fresno County, who's on the call today, Imperial County, Humboldt County, and also Alameda. So we partner with the county offices of education and their cross-sector leaders in their counties to help them develop their county and local ecosystem of care. And we'll go to the next slide. In the 3 years, T2 provides 3 integrated tiers of support. So what we've been doing, we've been helping with individualized coaching with our counties, with our 4 counties. So they receive individual coaching. Then we have a group of state leads and state partners who are helping to kind of be the brain trust or the thought partners in this work, which we call the Collaborative Leadership Working Group. So again, they help from the field. They help us to guide our 4 pilot counties in this work. They also help with the feedback on our implementation guide, which is being written by some of the coaches and leads of this work. And then also what today is our implementation guide webinars to really begin to inform the field around this work and to gain more counties engaged in this work outside of our 4. We go to the next slide. So here's a picture of just some of the partners who are in Transforming Together. And again, we call it T Square, right? So you might hear T Square, you might hear T2, but Transforming Together. Again, here's a picture of some of the partners who are engaged in this work. So when you're looking at on that left side, this is a picture of our website. But when you're looking on the left side, you see some of those state partners who are involved in our CLWG, or our Collaborative Leadership Working Group. And then on the right, you also see our demonstration counties alongside with our Education First, who is our facilitator of our meetings. They produce and help with even our webinars and our implementation guide. So again, want to call out Education First as well. So, and we'll go to the next slide. So how to build on the existing state work. Again, we're looking at, when we're talking about T Squared, we're really talking about CYBHI, community schools and system of care, the AB 2083 work around the state's guidance or their lead on each county supporting foster youth, homeless and foster youth. And what we are looking to do is to help counties expand that AB 2083 work or utilize AB 2083, that system of care work, to expand to the all of the youth in their counties. And so our guide, alongside with the work that has happened with CYBHI, the work happening with community schools, to help create the conditions for our kids to be healthy, to be successful, and to thrive. Okay. We go to the next slide. The implementation guide, what is it? And what is it not? Right. So the guide built on CYBHI, the Youth at the Center report. And again, these slides will be available to you all. So if you haven't got an opportunity to read that, a lot of the work that we're doing in T2 comes from these two bodies of work. Again, the Youth and Center report, as well as Youth and Behavioral Health Ecosystem Working Paper. Right. So those papers are foundational to the work that we're doing here in T Square. It's a practical and action-oriented how to for the eco paper, right? So after you read the eco paper, it gives you the theory, gives you the study behind it, but then the guide is going to help us implement that, be the implementation of that, and to support counties at different stages, and then online digital. It's a digital access to the T Square website. Okay. And the guide is not a mandate. It is not a one size fits all model. And then it also, this work takes time and the implementation is local. So again, that's where that coaching, the context is so important. Your county context, your local context is so important. And we wanted to, as we wrote the guide, really create it in a sense where folks can put themselves into a framework rather than a step-by-step guide. We go to the next slide. So again, as you look, when you think about the guide is going to be broken up into four chapters, but also with the introduction, right? So the introduction in chapter one, what we will be going over today, introduction is what is the NACO system of care and why it is necessary. So certainly we want to make sure we have a shared understanding of what we're talking about when we say ecosystem of care, and also a shared understanding of why it's necessary for our community and our youth. And then chapter one is around shared leadership and governance. So again, when we're thinking about those spaces like AB 2083, that gives us framing for a shared leadership and governance. What are some other spaces in your counties that you guys are already doing some of this and developing that shared leadership? So that chapter helped with that. And then chapter two will support around developing goals and outcomes that are shared by that leadership group and it can be implemented in your county. Chapter three, discussing the universal array and workforce development. So again, the universal array, we're talking about what supports and resources and tools we have in our counties, and ensuring that they're universal and they are accessible to our youth in our communities. And then from that, identifying some of those gaps so that we can build the workforce and develop the workforce to continue to build upon those resources, right? And then chapter four will really look at shared sustainability again, especially in today's climate. When we're thinking about funding, it's important for us to begin to be much more strategic and intentional about how we sustain the work that's happening. And so we're looking at in chapter four, we're kind of looking at continuous quality improvement, shared financing, shared information or data sharing, right? And then reciprocal accountability, right? So again, when we are looking at all of us in different agencies all agencies having the same level of accountability and responsibility to the youth that we serve and the communities. And we go to the next slide. And then I want to pass it over to Elizabeth Estes to take us through the introduction to the guide. Thank you, everyone.
Thanks, James. Hi, everybody. Good morning. Thanks for being here. It's super exciting to have you all here and be able to present this guide. I will add that the webinar is being recorded. So for anyone who wants the recording, we will make it available. And Please use the Q&A to ask any questions today, whether it's while we're going through these slides or at the end of the webinar. We're going to leave time to ask questions of any of the presenters on the information that you're hearing. So feel free to do that in real time, or feel free to do that later when we get to that part of this. So I just wanted to start by presenting the introduction to the guide. As James said, this guide has 5 parts: an introduction, chapter 1, 2, 3, and 4. Today, we're going to go through the introduction in chapter 1. The guide is developed both as a resource to build in the field, but also as a resource for you to train in the field about the work, this really exciting, transformative work that the state is supporting and creating this guide to enable. So let's go to the next slide. In the introduction to the guide, we talk about the current reality, the fact that California, very thankfully, and its administration is investing heavily into systems via very, very large reforms around better supporting the whole child and making services, as James said, more accessible to children and families so that children can be safe at home, in school. And so these big initiatives, we've only listed a couple of them here. There are many, many more exist currently in California. And yet, despite all these heavy investments, what we're finding is that the full whole child ecosystem that we are all striving to, that's transformed, united system, and its improved outcomes, need to be realized through uniting these bodies of work. It's going to be very challenging for us if we don't unite these various, very large initiatives that are all really whole child initiatives into an ecosystem that we understand and that best maximizes utilization of the resources that we have here in California, both agency and community, and really unites in care without duplicating services and supports or efforts in the field. And the work is really local, on the ground, which is one of the reasons why we wrote this guide for those who are local and on the ground. Next slide. Recent data in California still underscores, of course, the urgency for a whole child system. And some of that data is indicated here, and other parts of that information are incorporated into the ecosystem working paper that HHS published some years ago at page 6 to 11. So if you're interested in the bases for these whole child reforms and this ecosystem effort, it's incorporated therein. Next slide. We have this risk of fragmentation when we have so many initiatives in isolation. Services can become duplicative. Families have to navigate these multiple systems and the implementation of the initiatives separately. It does increase the workforce strain, and it can impact the efficacy and ability of the various initiatives to achieve the goals. You can go to the next slide. But if we unite and we create a system where we organize ourselves into a united ecosystem, where we understand that universal service and support array and the resources that we hold in our counties and communities, and we then make those accessible together for children and families, it can help everyone. This isn't a new initiative. It's a way of organizing existing work into one of greater coherence, which then can build greater accessibility, greater efficacy, less fragmentation, and better utilization of the resources that we do have, because we don't have duplication of services and supports. We've aligned those together. Next slide. In building the introduction to the guide, we wanted to be sure to create a definition of whole child. We did an analysis of whole child and whole person language in various publications and across the state and in various initiatives. And we really, in the guide, wanted to honor the fact that we're all trying to best serve the whole child, and that this is really a shared framework for collective impact. That child development is interconnected, children are whole human beings, and the system needs to be whole in its support of them. The problem isn't specialization. We have so many specialists across all of the agencies serving children and families and supporting children and families, including children and families. And so it's really about breaking down that isolation so that we can unite the expertise and supports and services that we have into one ecosystem. Whole Child is a shared lens. It's not a new program. Next slide. The shared principles that we found when we did this analysis was coordinating across agencies, making certain that our services and supports are developmentally appropriate, individualized, strength-based, and shaped by youth and family voice. And if we can all embrace a whole child lens together, then we can all build a whole child ecosystem together. Next slide. In the ecosystem working paper, which was the predecessor body of work to this ecosystem of care implementation guide, we did an analysis through research, and as I said earlier, the citation to that is above. And what we determined is that there are 10 necessary components of an ecosystem of care. Shared vision, mindset, and culture, shared structure, organization, and resources, and shared function, process, and outcomes. This is all about unity and figuring out how to create that unity. And so we're going to get into chapter 1, which is focused on the first step to the how, because we can all discuss this, but the biggest challenge is the how. How do we actually do this work on the ground and in our communities, by, for, and with our communities and our youth? Next slide. So I want to transition to chapter 1. And when you do go to the guide, you'll see the introduction, and then you're going to see chapter 1, which is really about the why, what, and how of building shared leadership by, for, and with children, youth, and their families. So we can go to the next slide. I wanted to talk a minute about why does shared leadership come first? Shared leadership comes first because from shared leadership and our shared leadership structures comes all of our collective impact efforts, all of our uniting in care efforts. We have to have a shared leadership structure in order to row towards the next chapter, which is the goals and outcomes that we want for children and youth, or the chapter after that, which is uniting our resources into a universal array, or after that, which is shared financing. Sometimes we build from these other functions before we build our shared leadership structures. And we have determined through our work that the way to begin the work is to have your shared leadership structure. If you build in a silo, then it is much harder to unite your resources at a later date. If you are building and uniting your initiatives now in shared leadership and shared leadership structures across your community and shared and agencies, then you can row together towards the outcomes that you want, the maximization of utilization of the resources, community and agency that you're holding, and the braiding and blending of financing and shared sustainability. So shared leadership is critical. It's a critical first step. And it enables us to have shared trust, authority, resilience, accountability, and anchoring in the needs, assets, and aspirations of our communities. So this is informed and driven by, for, and with youth, families, tribal partners, and community voice, not just institutional mandates. Next slide. Lasting systems change requires collective authority and accountability. We all need to own and care for and be working within the ecosystem that we want for our children and youth, which is our future. It's not just about accountability. It's about joining forces to build shared goals that we row towards together, and then, yes, hold ourselves accountable too. This is another way that we can address short-term funding or shifting funding by uniting resources. Next slide. What we find in the implementation of a lot of the initiatives and work in the state and in the field is that when they are implemented in silos, we tend to stay in that silo. We tend to return to that siloed norm. And this ecosystem building work, this collective impact building work allows us instead to operate a different way and to unite those bodies of work together. No single table sees the whole system. As I said, there are experts everywhere, but no single table sees the whole system. We have to unite to do that. And oftentimes decision makers, when they're doing implementation, are not aligned. But if we can get together in shared leadership and shared implementation strategy, we can become aligned around our goals. We can become aligned around our priorities, and we can become aligned around making services and supports available to children, youth, and their families when they need them as best we can. Next slide. We can have competing priorities and outcomes unless we choose not to. We can choose to develop shared outcomes and priorities, which is chapter 2, and begins with our shared leadership structures. Implementation advances can stall at key inflection points, particularly when pilots end or resources shift. But if we can build these ecosystem structures, then we can weather that over time together as an ecosystem that has united. Next slide. We're going to take a, I'm going to say 5-minute stretch break. We're going to come back at 11 o'clock, 11:02. And we're going to then get into our next slides, which is going to be all about the how. We're going to go through the how of building shared leadership across your agencies and communities. We're going to hear from Mathematica regarding a very exciting tool that they have developed that you can use to help you understand your ecosystem, the strength of your relationships across your agencies, and an ability to really use that tool to then reevaluate over time how strong your relationships are between competition to integration and better coordination. And we're going to hear from Fresno on their actual build. They are doing this work. They're doing an extraordinary job of this work, and we're going to hear from them. And then we're going to do our Q&A. So we'll be back at 11:03, and be thinking about your questions and put them in the Q&A if you have any so far. Thank you so much. To really the how, which is the really exciting part of this work that's happening in the field. So you can go to the next slide. And again, this is all in chapter 1 of the ecosystem guide. So when we talk about building shared leadership structures necessary in order to build an ecosystem in any given local county or region. We have been helping the field build a two-tiered leadership structure. And in many of the counties, this work is currently an outgrowth of AB 2083, which is the system of care work in California, which currently requires all counties to have a memorandum of understanding that unites them in care for foster youth. But that work is being expanded for all youth, to unite in care for all youth. So AB 2083 does provide a very strong foundation across agencies to do this shared leadership work and ecosystem work. Not all counties are utilizing that as their structure, nor do you have to, but the guide tells us how to build that interagency leadership team, and Fresno will be talking concretely about how they're doing that in Fresno in a minute here. But the role of the ILT is to set your shared vision, to ensure your shared accountability for the children and youth of your county and community, and to resolve any system barriers that may exist across agencies in uniting in care for children and families by, for, and with children and families in your counties and communities. And then that structure rolls down to an executive advisory committee. Again, not every county calls these the same thing either. Fresno has a different name for their interagency leadership team, and others have different names for their executive advisory committee. But the goal is to build your interagency leadership team, setting your vision, ensuring accountability, resolving system barriers, and then having an implementation team, which is the team that executes strategy. This is your executive advisory committee, or what you choose to call it in your build, but it executes strategy. It manages operations. It coordinates across agencies, and it has an upward feedback loop to the ILT to surface system patterns and solutions, to indicate what you're finding in the EAC about what your assets are, what your gaps are, what the barriers might exist across agencies or across the community in order to maximize utilization of your resources. And then that goes up to the ILT and then back down. So there's always this circular quality improvement that's happening in building an ecosystem. And within all of this is implementation of all of your initiatives. So that information, as you can see here, is being fed to the EAC and the ILT so that there is cross-system information across all of the various initiatives, no matter which agency your initiatives are in, around who you're serving, how it's going, your assets, your gaps, and the goal, the implementation and efficacy of the goals that you're setting for your children and children and youth in your county, along with your families. You can move to the next slide. This is also in the implementation guide, and it is a even more detailed visual of the role of an ILT and the role of an EAC in implementation of ecosystem leadership structures. It indicates not only who might sit at those tables, and again, that differs in various counties as you're doing your work and communities, but it also indicates what the roles are of those two different structures in your ecosystem build. And again, this is step one, is let's build your two-tiered leadership structure. And Fresno is going to talk about how they have gone about doing this and how it's going for them. And it really, in the building of this, really enables you to concentrate on these structural changes within your counties and communities that can then support your ecosystem work and withstand the test of time. If you implement these structures then the structures exist. Even if you have changes in staff, you can then put the new people who are coming into the system into the structures that you hold. So this is really about building the structures that you need in order to have sustainable ecosystem of care operating in your counties and communities with children, youth, and families at the center, which you see here. Next slide. We want to mention that community schools is a very large body of work here in California, not the only one. We also have others. We have, a family service partnership work. We have wraparound work. We have community schools work. We have juvenile justice reform work. We have aftercare reform work. We have early care reform work. All of these are trying to build a more whole child system for the populations that they are focused on. Here we have a graphic from community schools, and you can find one from other initiatives that say we will better unite to serve the whole child. In community schools, this graphic shows us that if you are doing community schools implementation, it really does require an ILT and an EAC. On the left-hand side, you see the community-wide leadership structure, which really is a parallel to building an interagency leadership team. You can see the roles here and the partners here are the same as the roles and the partners that are in our structures in AB 2083 and in other builds in the state of California. There's your interagency leadership team. And then that rolls to an intermediary leadership team. And the key role and function of that is, again, like an EAC, planning and coordination and management. And then you have your school site leadership, your community school site leadership. That is part of this ecosystem of care, realizing the most whole child effective system we can by, for, and with our children, youth, and families. And all of them are united in key system functions of community engagement, alignment and integration, professional learning opportunities, data and evaluation on our goals and objectives, finance and resource sharing, and policy and practice. So it's just a great example of a recognition that the various large initiatives that we have in the state are rowing towards this ecosystem work. And if we can unite them, we can best build the ecosystem of care that we want for our children, youth, and families in our counties and in our communities. Next slide. The key design principles for shared leadership, again, in the guide, the right size and authority. We're going to have Fresno talk about how they've done their build and how they began to build and what was the group of people that they brought in that was small enough to make decisions, but senior enough to align policy, funding, and accountability. Youth and family and tribal voice is everything, critical to all of this, and must be incorporated. You have to have clear roles, decision rights, and norms. Go back to that visual of our ILT and our ELC. What are their roles? Who has which role? What is each structure going to be doing, and what are their processes and functions, and who are the staff that are going to be doing the work? These are very, very critical components of this build. You have to have a host or hosts that choose to be the backbone for this work and that can host the work, the meetings, the agendas, and move it forward. You can have that be cross-system, cross-agency staffing, but that is a decision that needs to be made. Next slide. I now, in very exciting news, get to turn it over to Rick McManus from Mathematica to talk about a tool that they have created in order to help us do this work of shared leadership building in the field. I'll turn it over, Rick. Thanks.
Thanks, Elizabeth. It's nice to be with all of you today. My name is Rick McManus. I'm with Mathematica. We are conducting the evaluation for the overall Children and Youth Behavioral Health Initiative. And through that work, we have developed this tool that we have turned into a toolkit for all of you that and others across the state to be able to use to benefit your work. And it is really intended as a measurement tool to help operationalize some of the things that Elizabeth has just been talking with us about. And so, our goal is to help you operationalize your shared vision and what the roles are across your ecosystem. And so our intent is to support that through a structured tool that helps you understand what's going on in your community and the relationships between your entities in your communities and in your counties. So these are intended as tools that begin to operationalize your interests. So they do not answer all the questions. You cannot administer one of these tools and get answers that will solve all your problems. Rather, they're intended to gather information for you to then use within your unique context and build your leadership alignment, your trust building across your counties and across the entities that exist and are working together and trying to work better together to serve children and youth. If we go on to the next slide, Mathematica has produced what we call the NEIS. That stands for the Network and Ecosystem Experiences Survey. And this is the tool that we have developed and will now be available for your use. We applied this tool across 17 different counties in California as part of our county, what we call our county case studies. Those case studies are being published on the Cal HHS Evaluation Hub website for CYBHI. And that contains the results of this tool in that context. And now we have turned this into a tool that you can use in your counties to continue that work moving forward. This will appear in the implementation guide and will also be available on the Evaluation Hub website for Cal HHS for CYBHI. Okay, so with all of that, let me walk you through what this is. So this is a survey that can be used in your community that you send out or you ask for responses from a diverse set of entities across your ecosystem. That is all of the entities that you may interact with on a regular basis as you serve children and youth, or all if you are at a more central level in your county, as you look down upon that system, all of the entities that exist within your ecosystem who are serving children and youth. Each person who responds to that questionnaire rates the relationship with the other entities in that county on a scale from competing together, coexisting, all the way up to integration. So it is a way to quantify the relationships in your communities between organizations on this scale of just coexisting all the way up to full integration. And there's operational definitions of each of those terms. Then you can use that information once it's collected to visualize the relationships across your counties. This is done using what's called network analysis maps, and those are the figures that are shown on the right side of your screen. And what each of what we call those nodes around the periphery of those maps, those are each of the entities in the county. And then the strength of the connection is represented by the thickness of those lines. The thin line indicate weaker relationships, where the thick lines represent stronger relationships. So then you have a visualization of the strength of the connections in your ecosystem, the gaps, perhaps the silos that exist, and where there may be opportunities to move up that integration framework, get more coordinated, collaborate more, and potentially move toward that full integration component. So then that information can be used by decision makers, by all of you, to help understand how do we set priorities for what pieces of our network need to be strengthened, where the relationships may need to be strengthened in order to better serve kids. And it serves as one piece of information that can flow into your decisions and discussions about those topics. Before I turn it back over to Elizabeth, I will, again, this will be the toolkit will be a series of documents as well as templates that can be used to field the survey. It has information on how to calculate the scores and produce the network map. So it is essentially a end-to-end toolkit for you to be able to use to do this work in your county. This will also appear on the Evaluation Hub website, which I've mentioned a couple times, that is on CYBHI's website and that Sohail has posted in the chat. That it will be alongside other durable tools that we have developed. One of those other things will be an online data dashboard where you can look at outcomes related to children and youth and families and the CYBHI outcomes. And that will also be available on that Evaluation Hub website alongside the rest of our findings. So a couple of important reusable tools that we hope will benefit your decision making and be tools that you can use as you go through this work that Elizabeth has been describing. And with that, I will turn it over to Elizabeth and we can move to the next slide.
Thanks so much, Rick. Super exciting. So I'm hoping people can then go to that and use that to analyze where they sit between competition to integration and coordination across your agencies and community partners. We just created a list here, which is also, again, in the guide, around steps that you can take, not necessarily in this order, but to build your cross-agency leadership structures that we've been discussing here. So mapping and reforming cross-leadership tables that exist, what we've found in the field and in doing this work is you have a number of cross-agency tables that exist. AB 2083 is just one of them. There isn't a county that we have worked with or in that doesn't have multiple tables, and figuring out what those tables are, what their function is. There's a tool in the guide to map that, who they are, who sits at them, what their function is. Alameda County did a brilliant job of this in working on this, and there is an example of a template in the guide. And once you see that, you can really begin to understand how to unite them, what their roles are, where you may have overlap, and begin to really align the work. Build trust and a united mindset through clear vision and expectations. There's some really amazing vision setting work that has happened in the counties in doing this ecosystem leadership building work that we will be presenting, and that's also in the guide. Update your interagency agreements and MOUs to reflect your new broader vision for all children and youth. The fact that you are uniting your agency resources, you can utilize, as I mentioned, the AB 2083 MOU, which every county in California has, or you can be building some other MOU across your agencies if you choose not to use that, but it does provide a very strong basis for this work, and we have some examples of that in the guide. Establish and sustain recurring system operations and meeting norms. I talked a bit about that. You need a backbone, and you need to decide who is going to be holding that backbone. Then you need to use your staffing strategies to reinforce and support the system's interagency collaboration. Some of the counties are even working on people in the various agencies shadowing or working in some of the other agencies in order to really understand their operations and what they do and how they do it, so we can have that cross-system learning. Ensure your necessary interagency administrative support. Commit to shared data, measurement, and evaluation of expectations, and to naming your successes and making course corrections. We're going to get much further into that when we do the webinar on Chapter 2. make smart decisions to coordinate care and align resources, which sounds somewhat obvious, but it is intentional work. This is intentional work to coordinate care and align resources. The system often incentivizes us to operate in silos rather than together. So this is intentional work, and we need to make very intentional decisions to coordinate care and align our resources. Next slide. We wanted to give you an example, which again is also in the guide, of an action plan of what you might do in a series of 12 months to implement your ecosystem work, all the way from your shared leadership build to building out your sustainability practices, your shared financing, shared information strategies, etc. This is a reference tool, and it's in the guide, and we just wanted to be sure to make it available to you here so that you can see it. This is actually a plan that some of the pilot counties are using and working on as they're doing their work. And with that, I am going to turn it over to Fresno, one of our pilot counties, to talk about the work that they're doing. So thanks, Trina, for being here. And we can go to the next slide, Ian.
Okay.
And I want to say we have two partners here. We have Amanda here and we have Trina here. And I'll let them introduce themselves.
Okay.
Thanks.
Good morning, everyone. My name is Trina Frazier, and I'm the Assistant Superintendent of Fresno County Superintendent of Schools. I work in student services, and one of the programs that I oversee is our behavioral health programs, our 3 tiers of behavioral health. And so just super excited to be here. Can't wait to share with you what we're doing in Fresno, and I'll pass it to Amanda.
Good morning, everyone. I'm Amanda Rosen. I work for our Fresno County Department of Behavioral Health. My role within the department is as a clinical supervisor for our child welfare mental health team. That program is basically a liaison between DBH and our placing partners with Department of Social Services and Juvenile Probation. So our primary function is to ensure that all foster youth in Fresno County get access to the services that they need. And it's because of that connection to child welfare that my division manager and myself were selected to be part of the Executive Advisory Committee for AB 2083.
Okay, next slide. Okay, today we're going to start by walking through Fresno County's shared leadership structure and how we coordinate across agencies. In Fresno County, our leadership structure includes interagency leadership team, which we call ILT, and the Executive Advisory Council, EAC. Our goal here is to strengthen collaboration, align our priorities, and maintain consistent communication across child and family serving systems. And we're going to start today by talking about the ILT. The purpose of the ILT is to focus on any key updates that may impact coordination across systems. Our ILT meets quarterly and serves as our high-level space for cross-agency updates and alignment. But I also want to mention that all of the EAC members also attend the ILT meetings. And our particular ILT is made up of as you'll see on the screen, the Social Services Director, Behavioral Health Director, Public Health Director, Probation Chief, Superintendent of Schools Office, Regional Center, Tribal Leadership, Superior Court of California, Fresno. And so that's who makes up our ILT. And the ILT does have some major functions, and they are as follows. First, we have shared priorities and progress monitoring. The ILT reviews the shared priorities that are identified by the EAC. So we look at those, they vet those, and then they pretty much give their blessing on those priorities that we are going to follow. We look at the progress toward these priorities each quarter. So we're looking at that each quarter. And then second, we look at legislative, budget, and program updates. So we share updates around legislation, any budget shifts that may be occurring, any key programmatic changes, so that all systems remain informed of what's going on. And then third, we look at initiatives that may be going on in our county. So we highlight and discuss major initiatives underway across agencies or that may impact some of the other agencies. So if we think that it's going to have an impact on others, we want to make sure we share it at that meeting. We also come together annually for a retreat, and this is a half-day retreat, and where we really spend that half day taking a deeper dive into strategy and long-term planning. So that's how our ILT is set up. And we know that in other counties, they may be set up differently because they're not set up the same in every county. But I'm going to now pass it to Amanda, and she's going to talk about the EAC.
Thanks. So our EAC is comprised of many of the same agencies that are part of ILT, as you can see here on the slide. The primary difference is that the ILT is made up of directors and ultimate decision makers, while our EAC is considered to be more the boots on the ground type of staff. So our EAC is comprised of supervisor and manager level staff who come together to put those priorities for ILT into practice. Our DSS, Department of Social Services, took the lead in getting all of us together to start having these formal EAC meetings. And each year, a different agency will take the lead as facilitator, while DSS continues to provide analyst support with creating agendas and the scheduling. So right now, Department of Behavioral Health, me and my manager are the new facilitators of our EAC for 2026. Initially, when we started our EAC, we started by creating some group commitments to keep everyone grounded in our purpose and lay out basic tenets to abide by as we began examining our system. We also took time during each of our monthly meetings to have presentations from each agency to help us actually learn about each other. One element of our meetings that I believe really brings us together is that we always start with a check-in question. And these aren't your like basic icebreakers like what's your favorite salad dressing. These are real questions about what's working, what's happening in your area, or what's a barrier that you've experienced in the last month, potentially with another agency in the room. This really has created an environment where transparency is encouraged. By learning about each other, we began building and in some cases repairing relationships across our system. By including leaders from each agency, we've created the foundation for this trust and transparency to be spread across our departments, which will lead to better partnerships and the ultimate goal of better services for the youth and families in our community. Next slide. So now that you know a little bit about our AB 2083 structure, we thought it might be nice to highlight some of the work that has been going on in Fresno County. These priorities were created by the members of EAC. We came up with several areas that we wanted to work on, most of which were being influenced by regulation changes. And then we presented all these priorities to our ILT. During that meeting, when we were presenting our priorities, we had a very robust discussion with the different directors and agencies, and we asked that they give us input regarding prioritizing our goals and then ultimately endorsing them. So the goals that you see here are what we were focused on during 2025. So let's talk about the CANS, system-wide IP CANS implementation. For those of you who may not know, the IP CANS is the Integrated Practice Child and Adolescent Needs and Strength Assessment tool that CDSS has elected to use for all youth involved in the child welfare system. The CANS has been around for a while, but over the last couple of years, there's been significant push from the state to ensure that all youth are receiving a CANS, that those CANS scores are being put into the state system, and that they are being scored to fidelity. You may be asking yourself, why is this important now? The foster care tiered rate structure is why. This gigantic overhaul of how we fund foster care is going to use the IP CANS scores as its primary mechanism for determining levels of care for youth and child welfare. So the exciting part of all this is that CDSS wasn't the only department within the state that decided it was time for a change. Department of Healthcare Services, DHCS, who governs the county behavioral health plans, also decided they wanted to align their IP CANS use with their partners at CDSS. So our EAC decided that since the IPCAN's implementation and fidelity was going to impact two large areas of our system, that we would prioritize getting on the same page and working together. Within the last year, our placing partners have determined that they would take the lead on facilitating the completion of the IPCANs for youth in their system. They began training their staff while DBH and Regional Center and Education supported them by educating each of our respective sides of the house in the new processes that probation and DSS were going to be rolling out. This also included many discussions about the importance of sharing the cans, because as you may or may not know, sharing information is one of the most difficult things to do when working across agencies. So I'm happy to report that today our placing partners and DBH have now trained many of our workforce in the IPCANs, and our placing partners have submitted their CPIP, which is the County Practice and Improvement Plan, to the state with input from Education, Regional Center, our tribes, and of course DBH. With the IPCANs implementation and the added bonus of CFT fidelity, these will be ongoing priorities for us. But we did want to highlight that we were able to successfully meet many of those initial deadlines that were laid out during 2025. Now, the implementation of a state-approved universal release of information form and policy. So I know we aren't really supposed to have favorites, certainly not favorite priorities, but this was one of mine, I have to admit. We all learned at a very young age that sharing is caring. And then we all went to college and got into education or mental health. And we learned that actually sharing is not caring and it's also illegal. So with FERPA and HIPAA and court orders, we definitely had our work cut out for us when we started tackling the universal ROI. There were two elements that I must highlight as the primary reasons for our success in getting this priority accomplished. The first was that CDSS and DHCS put out an updated version of their child family team release of information, which gave us a form we could use without having to create our own. So that eliminated a little bit of a delay in trying to get a form created that we all signed off on. The second thing was the trust that we had developed since starting our work at EAC. DBH took the lead in asking our county council to review the CFT ROI to see if it met the HIPAA standards. And once we got the green light, we asked all the other members of the EAC to take the form to their respective councils and have it reviewed. Little by little, each agency came back saying it had been approved. We now had a form that was approved for sharing information from public health, DSS, juvenile probation, regional center, education, and DBH. At this point, once we had these approvals, we determined that this collective agreement needed to be memorialized, because sometimes when you get new people into positions, verbal agreements can be undone or changed. So we created a memo that outlined the purpose of the ROI and that all signatories on this memo had agreed to use it to share information across agencies. This was a monumental achievement, and now we are focused on rolling this out in a pilot to be used for youth involved in child welfare. However, we do envision that with the implementation of high fidelity wraparound as a Medi-Cal benefit, we will expand the use to any youth in our system who has a CFT. I'll pass to Trina. You're on mute, Trina.
Thank you. In 2025, we also looked at leadership meeting functional inventory analysis. We created one. And we created this inventory list of all the meetings where information may have been overlapping, and what we wanted to consolidate it or eliminate meetings to help avoid redundancy. This cut down on the number of meetings that members of the EAC attended and increased efficiency with people's time and the number of meetings that they had to attend. And this primarily affected our county agencies. There were a lot of meetings that had some overlap. And so I know Amanda was pretty excited when she had to go to a few less meetings. So this actually worked really, really well for us. And then we looked at renewing our MOU, our Memorandum of Understanding. So in 2025, our EAC and our ILT worked on updating the language in our MOU to reflect the current leadership structure, our shared priorities, and to more robustly align with the requirements of AB 2083. The goal of the MOU is to address systemic barriers to traditional interagency services, and it really takes into account the system partners, programs, and policies that members adhere to. The MOU serves as our guide to support coordinated, integrated, and effective service delivery model. Next slide. And now we move into our 2026 priorities. So we're going to go through those. The first one is to deepen the connection of system care work to CalAIM and the CYBHI. With CalAIM and the reform of Medi-Cal, it has opened doors to education to expand and braid their funding, and also collaborate with other agencies, which has just been absolutely wonderful. For example, through CalAIM and our specialty mental health services that we provide in schools through our agreement with the Department of Behavioral Health, we had to move from a cost reimbursement method to a fee-for-service model. And it really started to stress the importance of productivity for us and how important it was. But CalAIM has also expanded our relationship with our managed care plans through the SB HIP work. It's expanded our work through the wellness centers, which is an initiative of the CYBHI, and also the potential of enhanced care management, which we're working on now. In EAC and ILT, we now frequently talk about the CYBHI, SB HIP, the HCI wellness coaches, our tiered system of support that we have within the county and in the schools. We talk a lot about the work that we're doing through Transforming Together, because Fresno County is one of the 4 demonstration county offices that's participating in that. And we really want to deepen these connections between all of these initiatives. And I think that's been a real focus. And so that has been something we have been working on in 2026. The other thing we've been working on is conducting a gaps analysis of our shared programs. This priority is a priority for us because we want to identify and analyze where our gaps exist in our shared programs and come up with remedies to fill those gaps. We also know that through this particular priority, there's going to be a lot of conversations, because we know that we're going to have to discuss shared funding, and we know that can be a challenge sometimes. And so, but I think that we have developed trust with one another, and that we all want the same goals, and we all want everything we do to be child-centered across all of our systems. So I'm actually really looking forward to this conversation, because I think it's going to be a really, really great conversation. So that's one of the other things that we are working on. And then I will pass it to Amanda to do the other 2 2026 priorities.
Yes, thank you. So that next one, adapt and expand the Interagency Placement Committee to Interagency Service Coordination for all youth. This is another goal that we have for 2026. We realize that we want to expand that benefit of the IPC work. Currently, our IPC meets every Tuesday and discusses youth who are being referred for wraparound services or youth being considered for placement in an STRTP, which is a short-term residential therapeutic program. The IPC has voting members from DBH, DSS, probation, education, public health, and regional center when the youth also has regional center services. The group discusses the youth's case with their assigned social worker or probation officer and reviews the youth's history and presenting concerns. Having this standing meeting where all agencies come together to discuss our highest acuity youth is an invaluable resource that we believe can and should be shared across our system. That next one there, development outcomes dashboard. So this one is in its infancy. We haven't started it yet, although it is here listed as one of our priorities for the year. This was included in our AB 2083 MOU that all partners are committed to the development of a system of care dashboard, where we can determine key outcomes that we believe will inform the collaborative work being done by the ILT and EAC. This was originally presented as a priority or a potential priority to our ILT about 2 years ago. And now with the work that we accomplished in 2025, we believe that it can come forward as a priority for 2026 and build upon those things that we achieved last year. Next slide. You're on mute again, Trina.
I will get used to this. Thank you. And then for our MOU, we are so excited to say that in January, the Board of Supervisors did sign our shared MOU. And so we just couldn't be any happier. The work that we put in last year has really, really paid off. And we're just so excited that they were able to sign off on this. And now Amanda is going to share some of our lessons learned, because there are some very good ones. And so we need to see the next slide.
Okay, we made it. We made it to the last slide. So these are our lessons learned. I've been part of the AB 2083 movement in Fresno for the last 2 years. And after discussions with members who've been there longer than me, I can say with 100% certainty that we are moving in a new and exciting direction. What used to be a mandate on a list has now become a movement through our agencies. We've accomplished many of our goals, as we showed in the previous slides, and now I'm going to share a bit about what we've learned in the last 2 years. So the importance of relationship and shared vision across agencies. One of my mentors once told me that when you begin networking across agencies, you have to find dragon slayers. These are the leaders, with or without a title, the doers, the ones who share your passion for the work and are invested in you like you are invested in them. I can honestly say our EAC is full of dragon slayers, and now together we've developed trusting relationships that have given us the chance to make real change. We contact each other when things go sideways. We truly believe that each of us are doing our best and want to help. This didn't happen overnight, of course, and the thing that got us there was time spent together and truly learning about each other, especially focusing on our limitations. So I recently started saying we learn the difference between I won't help you and I can't help you. Before we knew each other, we always assumed it was I won't help you. That kind of thinking led to animosity, which often played out in our interactions when there was a complex case that had stalled. Now, when someone says I can't help you, they are able to offer the why, and the other person actually understands it and believes them, which has significantly changed the way that we interact with each other, especially around complex issues. We also learned that there's a new player in this game, and it's the managed care plans. The changes from CalAIM have significantly increased the amount of services our community members can receive through their managed care plans. The biggest takeaway was that we are not alone. It's no longer all these agencies that are all the payers of last resort. We now have community supports, enhanced care management, transportation benefits, transitional rent, and so much more to support our shared populations. We've invited the managed care plans to join our EAC because we value their partnership and can see how they will make our team stronger for our community. So one of the challenges that we have experienced, which is still a lesson, is membership turnover. So I know I just went on and on about how relationships are so important and that it's good to build it. And then you have somebody change. Someone's either reassigned to another task area or they leave the department completely. This has been something that we've experienced, and I can say it was a little painful. We didn't have to completely start from the beginning, but there was definitely a bit of disruption as we get that new person up to speed. Thankfully, so far, we've only lost one person at a time. So it's not been a full overhaul, but really one person leaves, we adjust, and then maybe one other person has left. But we have realized that it has really enforced the importance of memorializing agreements that are made and ensuring our work moves past this idea phase and into action, where then it can live on, despite who the members of the EAC are. This last lesson, sharing resources, it's an ongoing struggle. and I've heard it happens everywhere, so there's no shame in bringing it up here. Sharing resources with each other is probably something that's going to be the longest discussion that we have to have in our EAC. Most of us are probably aware of the changing budgets for many of the departments across your own counties. While mandates increase, funding seems to be decreasing. And this has really pushed counties to get more creative with resources, including participating in our favorite activity, sharing. Trina had talked about the service gaps analysis we plan to work on this year, and we believe that that will be the priority that throws us into the discussion about sharing resources. I'm actually a little optimistic that it won't be as difficult as most people think. Our ILT and EAC has truly established a shared vision for this work. And, you know, these aren't just DSS kids or DBH kids. These are our kids. These kids belong to all of us, and it's going to take all of us to get them what they need so they can thrive in our community. That's all I have.
Thank you so much. So amazing and exciting. And we have a couple questions in the Q&A for Rick. So I'm going to start there, and then we have a couple for Fresno that are in our chat. So Rick, we have a question about, I think you answered this, but when the NEIS is going to be available, did you say? Well, I'll just let you answer.
Yeah, no problem, Elizabeth. It will be available on the Evaluation Hub website. I would estimate in about 2 to 3 weeks. We're just putting some final touches, and then it will be launched both on that website as well as with the T2 implementation guide materials alongside that.
And then another question was how frequently counties and community partners can use the NEIS to evaluate the strength of their collaboratives.
Yeah, that is a great question. And the key thing to think about there is how long do you expect, or would logic tell you it will take for your activities to change relationships? The last speaker was just talking about turnover impacting some of these things, and relationships change not really quickly. And so an annual repeat of a survey may be a little too frequently. But if you do it every 2 to 3 years, that will likely give your the time that needs to pass for those relationships to evolve will then get reflected in the NEIS, and you can begin to see the evolution.
And once it comes out, does it provide information on like how to use it and access to you all to answer questions? Like,
Yes. So alongside the toolkit is detailed instructions, as well as contact information if you would like to get in touch with us, as well as supports that we can offer separately if your county is interested. But Mathematica, that information is included on the toolkit. There are some of those considerations as well as guidance on how you select the people that you survey, and how many respondents do you ask to reply, and how do you calculate the scores for multiple respondents. All of that is covered in the toolkit with the instructions.
All right, great. I'm going to turn it over to questions for Fresno, and Trina or Amanda, you can jump in here and answer these. But the first one was, how in your ILT and your EAC shared leadership work and implementation work, how do you interface with your member school districts? And maybe this is for Trina, given that you're at the county office.
Yes, so we share this information at our interagency team meetings. We also have them for All for Youth for our behavioral health program. And so we share out at that. I also share out during any of my standing agendas that I have with staff so that they can then take that information and share out with their staff. It really is about, like we go from cabinet to sharing information with our managers and supervisors who then share the information down the line to staff. And so we get the word out that way. And so that's how we are getting the word out through that.
And does it ever go to your superintendent's
Yes,
council?
it goes to our superintendents. It goes to our county superintendent has monthly meetings, and so this information goes to them through those monthly meetings.
Okay, great.
Yeah.
Let's see. I'm just scrolling through the questions here. I think you may have done this, but any concrete improved system operations and or outcomes for children and youth that have resulted from your shared ecosystem building work? I would just, given this came in before you finished presenting, so you did talk about a number of those things, but are there any highlights on like outcomes for youth that you might want to mention?
I know Amanda probably has some as well, but one of the ones I can think of that we didn't mention was we are prioritizing acute cases. And so we come together, EAC, when there is an acute case, and that maybe during that meeting, it may work out that way. But if it occurs between those meetings, we also come together as a team to look at acute cases, and how can we all, what can we all do, or what can we provide to help that child or youth. And so I think that's been a really, really important component and something that's come out of this. All of the members know that they can make, a referral to our school services. So that's been a real plus. A referral for us doesn't have to come from a school. It can come from anyone. It can come from the community, anyone. And so our referrals, we've seen referrals come out of that. We're able to connect to, say the student is in Fresno Unified or is in, Parlier Unified. We're able to make those connections right away and get that information out because we're all sitting around that table together, so we can pull those people in when we do have situations. So that's something that has come out of that, and Amanda probably has more things to share as well.
Yeah, just to add, those case consultations that Trina is talking about also are in our MOU. So it's a standing agreement that this body will come together to hear those complex cases, and any member of the EAC can call for a case to be heard. So it doesn't have to be a child welfare youth. It could be just a kid in the school. It could be just a kid getting specialty mental health services, which I think was pretty huge step towards our work of making this the whole system and not just the child welfare focus. I can also add from behavioral health standpoint, we've seen drastic improvement in the coordination that happens when a youth is at our crisis stabilization center and a 300 hold has been placed. And there's kind of discrepancies over who's going to pick the youth up, where's the youth going to go because maybe mom or dad can't pick them up. They can't handle what's happening anymore. And before, it used to take days to convene and get people together, and the whole time that youth was in limbo. And now it takes an hour before all the right people are at the table to discuss what is going to happen for this youth, what services can we bring to this family to support them and keep this family together in the community.
Okay, so now in the Q&A, there is a question that I'll read from Wendy in San Bernardino. Effective intervention requires a calibrated delivery that respects a child's developmental stage. Current systems often fail by grouping people across broad age ranges into the same administrative bucket. Hence, the current CYBHI fee schedule creates a service gap for the 0 to 5 age group by prioritizing school-linked reimbursement for K-12. Billing limitations for early intervention have left children 0 to 5 underserved. By restructuring planning into district neurobiological tiers, 0 to 5, 6, 12, 13 to 18, 18 to 26 plus, we can assure support is as dynamic as the families we serve. And I think this is more of a comment than a question. And I've often thought about the age ranges and being able to really build these ecosystem structures connected in by taking those age ranges, doing our collective work, but putting it all together in one cradle to career effort. But I'm curious, Trina or Amanda, do you have any sort of reflections on, there's a reference here to that 0 to 5 population.
Yeah. That's a good question. I love the comment. And I think that is something we have to make sure that we're addressing. we are actually serving through the fee schedule 0 to 25. And so we have quite a few students who are 0 to 5 that are being served. We are finding them through our schools, through siblings perhaps. We also have an infant program where we're providing in-home services. So we find some that way. We also have the Lighthouse for Children in Fresno, and we are getting referrals from them as well. And so we have our early care and education department knows about our services. And so when they see a family that may need our services, so they're also helping us get the word out about 0 to 5. But we have we are serving that population. Could we do better? Yes, absolutely.
Thanks so much.
Yeah.
Better together, right?
Yeah.
Okay, we're going to move, Anne, if you don't mind, we're going to go to the last slide here. I want to thank everyone for presenting. I think we have a slide here, Anne, Ray, the next webinar. Next slide. The next webinar is going to be really diving into shared goals, dashboards, outcomes. How do we realize that by, for, and with our children and youth? And that's March 17th from 10:30 to 12. One of the things I do want to mention is there's a lot of interest in the NEAS tool, but there are many other tools that we've cross-referenced in the guide. So if you go to the guide, you will see all of those tools. And if you feel like you want additional tools or need additional tools, feel free to contact us. Because we're here to try and make this work as effective as possible for you. And it is evolving work. This is not static work, nor are these going to be static materials. These are ongoing working materials. Next slide. We wanted to thank you for being here. It is noon. Thank you for participating. Thank you for your questions. Most importantly, thank you for doing the work. What happens on the ground is what matters the most for all of us, and by, for, and with our children and families and those who are trying to search and serve them. And so and empower them with us. So we thank you, and we look forward to seeing you in the next webinar. And again, if you have any more questions, please feel free to reach out to any one of us. Thank you so much. Have a great day. Bye.